All right. Well, welcome everyone once again to another Wednesday night webinar brought to you by NOCD. NOCD, an online platform for the treatment of OCD and related conditions. We're excited to have all of you here with us tonight, as always. And per usual, there's already lots of questions that are in the scroll, so that's exciting. And we have a guest with us tonight, one of our NOCD therapists, Barbara. Barbara, you want to introduce yourself and tell everybody a little bit about you? That would be great.
Yeah. So, good evening. And my name is Barbara Zelop, and I'm a licensed professional counselor, licensed professional art therapist, and a board certified art therapist. There's lots of credentials there.
It's a lot
And
of words going on
a
there. Yeah.
lot of words going on there. Yeah. I could have gotten just the doctor and gotten it all over with, but
Yeah.
but I've been with NOCD for 3.5 years now, and really enjoying my time with the company, and really passionate about treating anxiety and OCD. And I can say that I this is the best job I've ever had.
Well, I'm thrilled about that.
Yeah, it really is. I really am thrilled to service the people that I work with and be part of this amazing company.
Fantastic. Well, we're happy to have you, of course, and we're happy that all of you have joined us tonight. So if you're looking for help for OCD or related conditions, check us out at nocd.com, where we work with OCD and body focused repetitive behaviors like skin picking or hair pulling. We also do work with tics and hoarding, and we could treat the co-occurring anxiety disorders and mood conditions that often come along with OCD. So we would be more than happy to have you check us out again at nocd.com, where we work with people in the US, Canada, Australia, and the UK. We do take insurance for those of you here in the US. And if you are looking for just some information about OCD, we even have our NOCD 411 sessions, which are sessions where you can talk to one of our OCD experts and just ask some questions. It's not a therapy session. It's just more of an hour of time with us if you wanted to ask very specific questions about yourself, a loved one, what therapy might look like, all of those types of things. So thank you all for, again, joining us. And so, Barbara, what we usually do is we just kind of pop things into here and we check them out. I always read them. Sometimes
Mhm.
people have asked me why I read them, but I have a former colleague who unfortunately passed away, but he was blind, and it always annoyed him that people would not read the questions because he didn't know what they were. So, in case any of our listeners are blind, I always like to make sure that we throw this out there. So Jack says he's established that his thoughts are not logical. However, they still cause a lot of anxiety. He says, I choose not to act on them or engage with them, but they still hold a certain power over me. How do I get past that? I guess I'd wonder what the power over you is. I'll give you an example. Barbara, we've known each other for a while now.
Mhm.
Barbara, this may not shock you, but if you and I were standing on a staircase together, I would think about pushing you down the stairs. And
Absolutely.
and the reason is I've treated so many people with that fear that I can't not do that anymore. I can't not be on a staircase without contemplating the death of everybody on the staircase that I'm with. Those thoughts are there. They do not have a power over me in the sense that they do not make me do anything. And I'm wondering, Jack, if you're still concerned about yeah, but what if is the next time that it makes it? Or if the power over you is, but I have them and I still feel a little bit of churn in the stomach or some kind of discomfort. And I would say, but I'd be interested in what you say, Barbara. The reality of it is this, is that you may feel that way for the rest of your life. But just
Mm.
because you do have a reaction to something doesn't necessarily mean that it has a power over you. It just means that it's triggering for you. Otherwise, coleslaw has a power over me because every time I see it, I have a little bit of a gag reflex, you know. If that was the case,
Oh,
I would have
oh,
to say coleslaw has power over me.
yeah.
I just don't want anyone to confuse the idea that a reaction to something means it has power over
Mm. Yeah, I think I don't know if getting past I don't think we get past anything. I think we experience life as it is, and that becomes our experience, and it's part of the acceptance of what it doesn't matter if it's logical or not. It is that it's the acceptance of it. I in situations like this, I also try to use the non-engagement responses. You know,
you. Mhm.
I feel, affirming the anxiety I feel, or affirming the vulnerability or the powerlessness or the difficulty. I often say to my OCD, I don't like this right now. I don't like any of this, but liking it is not the same as having power over me.
Mhm.
It's an acceptance. Yeah, I
Yeah.
forgot to say that I have OCD as well. So, and I use ERP every day of my life now that I've learned about this. So,
Yeah, and I think that that's fascinating, and maybe if you wanted to, as much as you're willing to, tell everybody a little bit about that journey from being a person with OCD to now a therapist who treats OCD.
uh, well, it has made my life totally different. It has made my life more meaningful because I probably have had OCD most of my life, and nothing was ever diagnosed. I went to therapy. I have had some trauma, and I have had some PTSD that have been treated,
Mhm.
but what I usually received in treatment was a lot of reassurance and a lot of uh, people telling me that that I can get over this. I'm stronger than this, but never really explaining to me why the anxiety was always there and why the thoughts were always there. And no matter what I did with the thoughts, they would never go away, and they would always be there, and so much so that it would cause depression,
Mhm.
clinical depression, because I was doing so many compulsions, and most of my compulsions were, the non, observable type. It was just a lot of rumination, a lot of reassurance seeking, a lot of people pleasing, and a lot of avoidance, and it made me miserable. And
Mhm.
that journey of, feeling better after, I would say that I've been in mental health treatment for on and off for a good 35 years before I was diagnosed.
Mhm.
'Cause nobody even asked the question,
Mhm.
no one ever asked me, "Do you have intrusive, unwanted thoughts?"
Yeah.
And that the journey actually came by working here at NOCD and having that awareness and identifying, "Wait a minute, this is what's happening to me."
Mhm. Mhm.
So, uh learning ERP as a therapist here and recognizing, wow, it's not about the trauma, it's really about the thoughts around the trauma that then is transferred to everything that is triggering me.
Mhm.
And recognizing ERP standing up and recognizing the thoughts aren't going anywhere. It's doing the different that makes my life more meaningful, more value centered, and more and I feel higher self-awareness because of the acceptance of uncertainty. And that
Awesome.
was a journey.
Yeah. Yeah. I think that's amazing, and thank you for sharing that, because I think that's valuable for our listeners to know that OCD, though it may at the moment feel as if it is the ever-present most I'm gonna put in quotes, "important"
Right.
thing in your life, right? Purposeful quotes there. But you can, through your life experience, show people that that's not the case.
And I think also just recognizing and seeing people for how much they suffer because they're trying so hard. And I tried hard for decades. Tried hard in jobs, tried hard in another profession, and I didn't realize that I was just making myself worse. And how you just continually follow the spiral.
Yeah.
So doing different has significantly changed my life and improved my life and
Awesome.
made my life more meaningful.
And thank you for sharing, Barbara, too, because of course, if anybody has questions tonight about, you want to talk to somebody with OCD who had it for over 40 years
Mhm,
before even addressing it and
mhm.
now coming to the realization of, holy shit, that
This
was,
is me.
oh, like, what is this? Right? What is this going on here? I think it's a really powerful story, Barbara. And again, I thank you for being here tonight and sharing that with people.
Yeah, I think the other part of my OCD is one that I'm very passionate about, and that is my identity as an artist.
Hmm.
And I never fulfilled being an artist because my OCD would tell me that it's not good enough,
Mm-hmm.
it's not perfect,
Hmm.
it's not right, or what happens if someone doesn't like it, what happens if you're offending someone,
Hmm.
all the thoughts that kept on going on. And what would happen is I would just not make art.
Hmm.
And then when I had a profession prior to this that was in the art field, I was a fashion designer. I doubted every design I made. I doubted everything that I would do professionally because of fear that there would be a mistake, or it wasn't perfect enough, or it wasn't right.
Yeah.
And that just would continually make me be in loops. And it was very hard. I stayed in my profession for 25 years, but at the end of it, recognizing, yeah, I need to do something different. Who knew it would lead me to this in the first place? But
Right.
what I really enjoy, that I'm able to do here at NoCD, is that I have the creative expression support group Monday
Hmm.
nights.
Hmm.
And so fellow creators like myself, we all come together and we support each other and stop suffering because we're not trying to do it perfectly.
Celebrate the mistakes, shall we
That's
say?
what it
Yeah.
is. And we do purposeful
Hmm.
mistakes.
Wonderful. James says, hello, hope all's well. If a family member calls me and I forget to call them back, I feel guilty. What's good ERP? First of all, I don't want to just throw that in the OCD thing because I think a lot of people might have some guilt if they forget to call somebody back. So that could be just a normal, natural kind of feeling that people have. And I never want to disavow the fact that people without OCD also feel guilt and shame and disgust and don't like some of the intrusive thoughts or images or urges they may have as well. In this case, if you're finding that you do a ton of apologies, I would say don't apologize, would be one of my things. I know I often work with people who will throw in a lot of sorries. And I've even worked with people who I've said, starting tomorrow, I will not accept any apologies from you anymore. So if you say I'm sorry, the first thing I'm going to say to you is I don't accept that. And then we move forward. We move on
Mm.
from there. Mhm. So, Joe's got kind of a long one, but I'll kind of come to the end. Uh, he talks about a battle to avoid physical compulsions and asks if we've heard of the fact that his intrusive experiences are more feelings than thoughts, and says that that uncomfortable feeling is with him throughout the entire day. And he feels like he tries to do things that are good for him, and it's a constant battle whether he deserves to feel good.
Mm.
Not uncommon in
No, no,
OCD.
I get that. I didn't know my thoughts for years. I had the
Mhm.
feelings. I
Sure.
felt a lot of guilt and shame and
Mhm.
like a lot of mind reading, like thinking
Mm.
people didn't like me or that I might have insulted someone accidentally or what have you, and that would keep me looped. And yeah, it would make me feel terrible all day long
Mhm.
because I was focusing on the feelings.
Yeah. You know, just because we feel something, doesn't have to mean something. And let me and Barbara, you throw in on this and tell me what you think, but I've worked enough with people with OCD to know that OCD is going to scan constantly to see if you're having a certain feeling or not, be it a physical feeling, an emotional feeling, whatever it will be. And it will punish you for
Mhm.
having that feeling because it will say like you're not supposed to have a groinal response in a certain situation, or you're not supposed to feel good because if you do, maybe you'll let your guard down and then you'll do something bad or wrong, and you're always supposed to be putting yourself down, and that's what's going to motivate you more than anything, by reminding yourself of what a shit you really are. And of course, no one with OCD tells anyone else to do this, right? I mean,
Mhm.
I'm going to bet if you, Barbara, look at all the things that you might have used to motivate yourself through all the years before knowing what OCD was, you would have never said to anyone else the things you probably said to yourself.
Oh, never. And I now call it the itty bitty shitty committee because that is what it is. It's nonstop, just going on and on and on. And it's just like I would never talk to anybody the what's going on in my head.
I think we've coined a new term tonight. The itty bitty shitty committee is fantastic, by the way.
Yeah.
I love that. That's,
Well, I can't take credit for it
mhm,
because I've heard it my whole life,
mhm.
and it is yeah, but I used to try to control myself by talking badly about myself.
Yeah.
It's remarkable how ineffective it is,
Yeah.
but I would just keep doing it.
Right. Right. Maybe today will be the day I finally talked bad enough about myself and then I can stop doing it. Right.
It's remarkable as to how for a logical person, I would say, "Okay, I couldn't understand why it didn't work." It was
Yeah.
like, "Why?" And it's just like, "Yeah, it doesn't work." And in this case, really focusing on my values and what's important to me is really what because I do have bad days. They happen. Some days I get up and it's just really loud and I'm just like, well, I'm just going to do use my tools, put one foot in front of the other.
I'm glad you said that because sometimes we get questions on here about why do I have good days and then I have a bad day or quote unquote. But do we know? I mean, no. Mm,
I don't know, but everybody has bad days, and I don't think I'm excluded, and I don't think I'm
no.
being punished.
Mhm.
And I used to think if I was having a good run, it was always when is the other shoe gonna drop? Like what's gonna happen next, before this all happens. And now I don't think like that anymore. I don't even it's so interesting how when you really focus on different and you focus on your values, how the the ongoing talking back um, to the thoughts and the urges just kind of like they get softer.
Mhm. Alex says, I'll do things that seem like exposures and then they backfire and I feel like I did something wrong. How do I work with that? Go. You're already nodding, Barbara. Take it. Go. I'm just
Well,
gonna sit back. I'll just pull some questions up. You go ahead. Okay. Mhm.
it's kind of a two-part thing because if you're thinking that you did something wrong, I'm gonna like my question's gonna be, tell me about that. So you made a mistake. Like, okay, we all make mistakes, right? But Sometimes in doing exposures, if I'm trying to have an effect from the exposure, sometimes I'm looking for the anxiety to go away. That's not the purpose of the exposure. The purpose of the exposure is just to increase my relationship with uncertainty and increase my distress tolerance.
I love
So,
that. I love that.
yeah,
That's
I
great.
mean,
Mhm.
it's for me, it's recognizing, okay, if I feel bad, maybe I am doing it right. Uh,
Mhm.
I don't know. Do I feel uncertain? And that distress tolerance, I can't tell you. For years, I went to every therapist that said, "Oh yeah, we have to take away your anxiety. We have to get rid of your anxiety." And it was just making me feel worse. I feel more um, you know, powerful in my own skin because I've grown my distress tolerance.
Mhm.
And I tell myself all the time, I can do hard things.
Yeah. And then there's people like Anne who have more of the numb feeling. So sometimes we might feel really anxious and sometimes we might get to the point of feeling numb, which is
Mhm.
just another coping strategy our body or our brain might go into as a way to pull ourselves away from thoughts. So she's talked about thoughts about murdering her sister. She saw a news event about it and now says she doesn't feel anxious with the thought and now believes that I want to do it. Now, Barbara, I've always used this example. At
Mhm.
some point tonight,
Yes,
there's a potential
there is a potential.
that I will take a bottle of alcohol in my house, put a cloth in it, light it on fire, and throw it as a Molotov cocktail at my neighbor Dave's house. Then I will go in the middle of the street, take a poop in a bag, and then light it on fire and put it in front of my neighbor Josh's house. And then he'll come out and he'll stomp on it and he'll have, fiery poop on his shoe and I'll laugh at him. And then I'll
Why
shoot a
not?
couple of geese that are flying over my house. And then I'll come back in and I will join the webinar. And Barbara, how much guilt or anxiety or bad feeling should I have about that?
Um, None.
Why? Isn't it terrible? Wouldn't that be awful if I did that?
Well, if you have an intention to do it, but words are just words.
Mhm.
I mean, words and thoughts are not intentions and not part of your value system, as far as I know. I mean, I do know some things that you don't like, but I
Like
haven't heard you talk about
coleslaw,
those.
coleslaw
Yeah,
is
coleslaw.
definitely, yeah,
Coleslaw.
definitely up there.
Yeah,
Yeah. The, the
yeah.
devil's food, as far as I'm concerned. Yeah. So, along with blue cheese. Oh, terrible. Just terrible.
Yeah,
Mhm, mhm,
but, it's even with some foods, like,
mhm.
I'm not a pickle person, but, like,
Not
I've
saying
eaten
I
a
love it. I
pickle,
love pickles. I love
and I
pickles.
have not died, you know?
And
It
I'll eat coleslaw, but I will be like cursing the person who made it, who put it on my plate while I'm doing it under my breath, but I'll eat it. Yeah.
yeah,
Mhm,
I mean, you don't die.
mhm.
Not yet, anyway. I
Right.
could.
Shayla says, I have anxiety when I don't do compulsions. I have anxiety for not having anxiety. I feel like if I'm not checking, then that it means it's true. You know, Barbara, let me ask you this.
Mhm.
I'm going to go along that with something Shayla had said. Uh, I believe the phrase, I feel like, is one of the most insidious phrases that we have because there's nothing that couldn't be justified by, but it feels like, or I feel like.
Hey, feelings, I don't know about you, but I tell myself feelings are not facts. Feelings are not facts. They're just feelings. And I can have all the feelings in the world. I can have a lot of feelings that are very complicated, but I have not had a feeling yet that has killed me. Not yet. I mean, I guess it's possible, but I've had very sad feelings. I've had grief. I've had many, many feelings. They're challenging, they're hard, but I'm not watching for a feeling to go away. I'm not
Right.
waiting for a feeling
Mhm.
to go away.
By the way, Rachel says hi, just so you know. She's watching So, I don't know who Rachel is, but she says hi.
Okay.
Bailey says, I work with art therapists and they're amazing. Can you tell us a little bit about how you use, how art and expression has been a
Oh,
part of
sure.
some of the work and the support group that you do here at
Oh,
NOCD?
yeah. Oh,
Mhm.
yeah. Well, so it can be as simple as if someone's afraid of stabbing their family, for example. We can draw a whole series of knives and how the knives are going to be used. And we can even draw, cutting the skin and what have you. I mean, we can use the expression of the fear and make art out of it. I had someone who actually made a whole series of their intrusive, unwanted thoughts and actually had it displayed at one of the international OCD um, conventions as people with OCD artwork, and they're helping people using their facing their fear by using their creativeness. So,
Mhm.
I have people writing songs about things that they're afraid about, things about something bad happening to their family or getting an illness or their, possibly their apartment being on fire. Creativity, you can use it to lean into the fear.
Yeah.
And then it becomes even something more meaningful. And let's say it's a song, they're singing a song about a fear. And then just as the words lose meaning when we're doing exposures, the song loses meaning as well because they're singing it and they're hearing it over and over and over again. And they're just like, oh yeah, that was the time that I used to be afraid of that stuff, but I'm not really afraid of it anymore. But they they have like something that they can always see that it's a part of their past, part
Yeah.
of what happened, but it doesn't mean it's happening now. And it's just an expression of creativity,
Yeah.
just like thoughts are.
Art.
In the support group,
Yeah. Oh, yeah.
we
Please, please.
we do
Mhm.
something. So since it's a support group and it's not therapy, so we can't really talk about
Yeah.
what people make. I give them a prompt, and from the prompt, they'll create something off camera or on the side. They take about 20 minutes. Everybody comes back, and then I'm like, then we go, what did you learn about yourself? So did you just like do something? Did you just make mistakes for 20 minutes? Did you find out that you were able to rhyme words with something that you were afraid about? Because usually artists are afraid about perfectionism or making it right. So whatever they do, they're learning about something about their creativity, and the creativity is addresses their value system. Their OCD doesn't want them to create. Their OCD wants them miserable and thinking about it and punishing themselves by not making anything.
Mhm.
So by doing it and practicing, I recommend 20 minutes of creativity every single day
Mm. Mhm.
to help yourself move through that wall of avoidance.
Mhm.
No matter what you make, it doesn't matter. And you can do it with non dominant hands. So it's particularly not right.
Mhm.
Right. So if you draw with your non dominant hand, it's going to be off, and you have to sit with it being off. You have to
Yeah.
sit with it being not what you wanted, not perfect.
Yeah. And other people might do things like they like to exercise, right? They like to move, right? So you can move through dance, you can move
Hmm.
through walking, you can move through lifting, you you move through jazzercise. You
It
have
doesn't
ways
matter.
of doing, but doing it, engaging in life, I think,
Hmm.
is so important because OCD says,
Don't do it.
don't do that. No,
Nope.
don't.
It's not
You
going
know,
to be perfect.
Barbara, you are You are not supposed to have any pleasurable feelings at all. You should feel only guilt and shame and disgust and anxiety and distress for these terrible, awful things that pop in your head all the time. And what we should probably throw you in jail, actually, Barbara, for
Possibly,
possibly.
possibly. Yeah.
Yeah.
So I have another view that I also do when I'm in the support group that has some really awful paintings that I did behind me. And I use that purposely
Hmm.
as and saying, yep, they've been there now for a couple of months. And I don't particularly like them,
Hmm.
but nobody has said anything to me. Nobody has pointed out, that one's particularly bad
That's a
behind you.
shitty painting there,
There you
Barbara, that
go.
you did.
Like,
Yeah.
no one has ever said anything to me. And it's just like, well, and so that's what would prevent me from making art. I have a painting behind me that, oops, it's like right there,
I see it.
that I've been working on for 2 years
Hmm.
because and I'm pushing myself to get it done now because it wasn't right. And I'm just so fed up with it that I'm just like, it's gonna get done and that's it.
Hmm.
And it's a very belated birthday present for my sister. So there, I said it. It's
There you
out
go.
there.
Hey, sister, this shitty painting is coming your way soon, just so you know, right? Just so you're aware.
Yeah, because that's how much I love her. So
Yes, yes,
yes,
yes. That's how
yes.
much you love her. Yeah. But isn't it fun to be able to get to the other side and be able to
Oh,
poke some fun at it and just be like, screw you,
uh,
OCD. Yeah. Hmm.
it has actually. This is like the biggest gift that I've ever had. That's why coming to this company has just been so life affirming for me
Hmm.
because I got my art back.
Yeah.
I didn't have it prior to this. I had it like once in a very long blue moon, but most of
Sure.
the time I was just depressed.
Yeah.
Yeah.
And now
Now I'm
it is what it
making
is,
it,
right?
whether it's good or bad, I'm making it.
Yeah.
Yeah.
And OCD loves to even throw labels like that, good or bad. And that's why we always say,
Ah,
and like exactly what you said earlier, a thought's just a thought. That's I don't label thoughts as good or bad or right or wrong or evil
mhm.
or terrible or anything. I just say a thought
Yeah.
or an image or an urge. That's what
Yeah.
it is, right?
And I tell most people, creatives that I work with, that all art is subjective. It's
Yeah.
personal.
Mhm.
And the most important thing is for you to make it no matter what,
Yeah.
because um, it's the best exposure you can have.
Right. And I even say too, thoughts don't make you feel anything because if they did, anybody having that thought would have to feel the exact same thing.
Yes,
Right.
it's true. I mean, the ceiling has still not fallen on my
I
head,
have wished and
although
wished and
I have
wished and
wished
wished
upon like that it would
and
fall on me. And
wished.
yes, no,
Mhm.
no falling ceiling, none,
I have
none.
carried a card in my wallet for 18 years saying, I hope my parents die tonight, and they are still here, you know?
And
So,
in the spirit, I have also taken up that one as well. I
mhm.
don't carry it, but I often say that it's possible that my parents will drop dead. So it's
One day we're both going to be right, just so you know.
yes,
Yeah,
I
one day.
just
Mhm.
know that, but it is the journey of death and doing death work with people is
Yeah.
actually an honor and a privilege.
Mhm. Yeah.
We're all gonna die.
We have one. Someone's in a relationship. If they see someone attractive or not, they have to tell their partner, or else they get anxious and feel guilty. Of course, it helps them, but it hurts their partner. And isn't that the selfishness then?
Mhm,
And again, I mean that in all respect. I'm not saying that a person is
mhm.
selfish, but isn't that the selfishness of OCD saying
It is. It
it
is.
doesn't matter what anyone else thinks. What matters is what I want. And even if I wreak havoc on your life, I don't give a shit. I'm what's most important. Me, OCD, the most important thing in your
OCD,
life.
right,
Yeah.
and
Mhm.
and yes, and OCD, when it was active, I was
Mhm.
very self-centered,
Yeah.
and I was miserable.
Yeah.
I was miserable, and I didn't realize why I was so, miserable. The other thing that I've also found out is that gratitude is an antidote.
Tell us more. Mhm.
So I have a gratitude practice that every night I have an app that's called Three Good Things. It's free. They're not, and it pings me, and I log three things I'm grateful for. And when I'm practicing gratitude, the joy that I get that I denied myself for years
Right. Yeah. Yeah. Mhm.
because all I was thinking about was misery
Yeah.
and what a bad person I was, instead of what gratitude brings, which is joy and
Yeah.
awareness and connection. Oh, that's the other thing. The other thing that OCD hates is connection.
Ooh. Hmm.
Be a loner.
Yeah. Yeah.
Don't tell anybody anything.
Right.
Don't be connected to anybody, because this way, you can just keep everything, quiet and have lots of secrets.
Hmm. The other thing that's coming up just as I'm scrolling through this idea
Mm,
of contamination, which is
mm.
not only a germ, but a
No, it can
but
be
a
a feeling.
feeling.
Ah,
Did you ever
yes.
have that, Barbara? Was that
Uh,
ever part of for you or
no, it
no?
wasn't, but I've
Mhm,
had a couple of cases where people
mhm.
have feeling contamination, and it's really like it's a memory or something, like something bad happened to them, and it's just like it's a reminder
Yeah.
that if I touch this, then I have to go wash because I can't tolerate the memory. And it's terrible when the past is not the past. I mean, OCD wants one foot in yesterday and one foot in tomorrow, so you
Yeah,
just piss on today. I mean,
that's
that's
right.
all
Today
it is.
sucks. Yeah, today
Yeah,
today doesn't matter. Yeah, right.
it
Mhm,
doesn't matter. It doesn't matter.
mhm.
It wants you trying to change the past, and I tried to change the past.
Mhm.
Like it well, unfortunately, it was for decades, but now I recognize it is what it is. It's over.
Mhm. It's hard for someone here to say, they say it's hard to not ask what something meant when people say something. They always assume the worst. And yes, one of the things that OCD does, and maybe you had this, Barbara. And again, this it's so fun to have someone on here who has OCD and is so willing to talk about it. So thank you again for that. OCD leads you to doubt your own
Mhm,
senses.
mhm,
Did I hear that? Did I see that? Did I
mm,
say that? Did I
mhm.
experience that? We have real event OCD. How can one prove to me that this is what the actual event was? My How do I know my memory's right or anything like that? So when we doubt ourselves, doubt our memory, doubt our experiences, doubt our senses, there's eh,
Oh, there's a lot. You can doubt everything.
yeah, you can
Doubt.
doubt, right. In the world of OCD, there's nothing impossible.
Mm. There is nothing impossible. It is something where I have laid awake at night not being able to fall asleep.
Mhm,
And because I was afraid of not being able to fall asleep.
mhm.
And
Yeah.
the
Isn't that
thing
fascinating? Yeah.
I know.
Mhm,
And the thing that I remember the first time that I did ERP was for that. And I
mhm.
started saying, "It's possible I won't fall asleep. It's possible."
Yep.
And within 5 minutes,
You were
I
sleeping.
fell asleep.
Mhm.
And if it happens, I do the same thing. And it's helpful because eventually my brain gets tired of it and goes to sleep.
I've even seen people who will stay up all night trying to go to the bathroom to make sure that they don't have to wake up and go to the bathroom,
Well,
which means they don't sleep,
yep. Yep.
and they create the very thing they're afraid of, which is not sleeping, by
Yes.
staying up all night to go to the bathroom. Mhm,
Well, and that urge is always gonna be there if it is an OCD urge, right?
mhm,
So,
mhm,
yeah, there's always the, "Okay, let's get you checked out just to make sure we don't have anything going on,"
mhm.
but yeah, definitely definitely that. I've also had the whole thing with the, like, did I close the garage?
Mhm.
and driving back and checking the garage, or medication, like, did I take that pill? Did I
Mhm.
like, and not knowing it, and then trying to remember if I took it. And so actually this came up today, because I wasn't quite sure if a pill box with the days of the week on it would
Mhm. Mhm.
be would be a reassurance.
Mhm.
So I was like, I will ask the expert if it is. If you use a pill box to
Mhm.
put your pills in for the week, and you take your pills out and that's it. You don't check it that you used it. But is that reassurance using a pill box?
So, one of the things we're looking at for the definition of OCD is the amount of time it takes out of your day, right?
Mhm,
Um, if you can use a pill box, take it and then move on,
mhm,
doesn't sound like it's really interfering in your life, right? But if you're going back, even though there's a label on it and you're still checking it and you're doubting it,
mhm.
does the label actually really matter or not in that situation? No, no, it
No,
doesn't. So,
no.
uh, it's funny. I have a pill box, but I take them randomly. I just whichever one I happen to open that night is the one that I take. So I still have no freaking clue if I actually took something or not. I'll be like, I think I did. All right.
Well, and
So
that's kinda like what I've done for myself too. I'm just like,
yeah.
maybe I did, maybe I didn't." And the
Hmm.
same thing with the garage. Drive
Yep.
away,
Hmm.
drive away.
Yep.
Let the house be robbed.
Right.
Um, yeah, I've never left it open.
Yeah. Anne says, why does it feel like I have an intention to do it though, even though I don't? But well, again, you use the magic phrase feel like.
Mhm.
So I feel like calling Barbara right now off camera and telling her how much I hate her. That's what I feel like doing right now. I'm not gonna do it, though. I'm not gonna call Barbara and tell her how much I hate her. I just feel like it.
Mhm. Yeah, I mean, feelings, I could feel like, I might not go to work tomorrow,
Yeah.
but I wake up every day and I go to work.
Mhm.
So it's just like, and that's actually a good thing. Why do I want to go to work? Because it affirms my value system,
Mhm.
right? I may have a feeling I don't want to do it, but feelings are not part of my value system.
Right.
I value hard work. I value commitment. I value persistence and perseverance. So I have lots of feelings, but whether or not I act on them or do anything about them is just like, aside from feeling uncomfortable, again, I can't. I love those NERS, those non-engagement responses. Oh, I feel anxious. I don't like how I feel.
Mhm.
This is difficult. It's possible. And affirming myself, but I'm not reassuring myself. And
Yeah.
that gets me through and helps me focus on what I'm trying to accomplish.
I don't mind assurance. I don't like reassurance.
Ah, it's interesting.
Right?
Right.
Once is there's
Once
a
is assurance.
yeah, there's a book called When Once Is Not Enough, and I think that that's exactly
Mhm.
what we're talking about there, right?
Yeah.
And again, going back to there's nothing that you couldn't use it feels like to justify doing something. And OCD loves the phrase it feels like or what if. And with those two phrases, but it feels like or yeah, but what if, you can OCD can justify absolutely anything.
The people who don't drive because they have
Yeah.
the intrusive thoughts that they're going to drive into the intersection
Yep.
or
Ram into
into
people. Hmm.
ram into people. And there was a time that was really big for me.
Hmm.
And so scared. I had no idea what that was.
Yeah. Barbara,
And go
oh,
ahead.
go ahead. Go. No, no, finish up. Finish up. I'm sorry.
Yeah, I just had no idea what it was. And at the time, I recognized that I was going through a lot of hard things, but I never once acted on them. They were there. I never acted on them.
Yeah. I've heard a rumor, Barbara, maybe you will tell me if this is true or not, but I heard a rumor about you. And the rumor is that you have a scrapbook of all of the newspaper headlines that start off with person with OCD actually goes and does that thing. Is this true or not true?
Uh, I don't know of any such scrapbook.
Oh, okay. Okay. All right.
Yeah,
You know why it's not true, Barbara?
uh, because there's no evidence.
There's never been a newspaper headline of that.
Yeah.
Uh,
Yes.
I remember once doing one of these, and someone commented, "Tonight we have 101 people on right now. We have joining us 101 of the most dangerous people in the entire world, or
Mm,
we have 101 people with OCD."
mhm. Yeah, it could be either way.
It really could be, couldn't it?
It could be
Mhm.
either way
Mhm.
because those OCD people are very smart, highly creative. They could be masterminds, maybe.
Mhm. Yeah. And yet, I still, I don't know of anyone that I've treated who I've had to go to court for
Mm.
and stand up as a character witness because Dr. McGrath, you did treat this person, and then they did go do that thing actually.
Right,
So
right,
you
and
know,
yeah, and it's really interesting because the other population prior to this job that I used to have was the severe, persistent mentally ill, and a lot of people with schizophrenia and psychosis,
hmm
and there's such a world of difference that how many people that I have treated that are afraid they're going to become psychotic,
yes,
or they're afraid they're going to go in the middle of the street
yes,
and
poop
stab
in a bag and
people.
light it on fire, right,
There
or
you
something
go.
like that. Yeah, Mhm.
And
Mhm.
and yet no one did. So
I'm always I'm either shocked or not shocked. I'm really not shocked whatsoever
mhm,
because I don't believe a damn thing that OCD says whatsoever.
mm. Well, it's come up with some creative things, but as I fondly call it, the itty bitty shitty committee,
hmm
it is it's no friend of mine. It's a part of me. I understand it. It's always there, but it's kind of become white noise,
Yeah.
and it can become white noise for other people too when you embrace ERP and your values, don't try harder, try different.
Geez, I wonder if someone ever wrote a book called that. By the way, I don't know.
I've heard
Mhm.
about that.
Yeah.
I've heard about it. I think I have it right over here.
Oh, what do you know? Yeah. Uh, it is. It is a fascinating, I will say, thing to work with is OCD. I 25 years now of my life have
Mhm.
almost half my life has been treating obsessive compulsive disorder. 25 years now of doing this. And I still every day excited to work with people and to help them live the life that they want to live and not the life that OCD wants them to live. Because I'm going to bet you didn't live your life for a very long time. You
I
lived
didn't. I didn't.
OCD's life for a
I
very
lived, yes. It was as certain as I could make it,
Mhm.
and I didn't take risks.
And it still wasn't enough.
It was never enough,
Yeah.
and there was never enough reassurance in the world that would make me feel better.
Mhm.
And but what I have learned is a secret that OCD hates, which is courage is contagious. the more you're being courageous, and the more I do hard things, the more actually I attract people who are courageous. And so we start encouraging each other, and it's the encouragement that is so lacking from the, it's so much reassurance versus encouragement. Encouragement and support is what we give people who we treat. Encouragement and support that you can do hard things. And which is such a different language than what the OCD speaks. It is such it's very empowering, and it builds confidence and self-esteem.
Hmm.
And when I'm working with someone, I said, if you want to build self-esteem, do esteemable acts.
Hmm.
And if you're doing esteemable acts, you're following your values, and then you're going to feel good about yourself,
Hmm.
because you're not trying to be somebody that you're not. You're working towards something that's very powerful and meaningful to you.
Hmm.
And that can be anything. Um, and it doesn't matter whether or not you believe in God or not. Treated people with scrupulosity, and you
Treated
know,
atheists with scrupulosity.
there
Yeah.
you
Hmm.
go.
Hmm.
But as you said, it's not a religion problem; it's a feeling problem.
Hmm. Yeah, it's the great debater, right? OCD is,
Oh, yeah,
but it's not a fair debater.
no, no, because it always will change the subject. Because once you
Yeah.
might have something here that'll be like, but what about this?
Hmm.
And then what about this? And it's just
Hmm.
like, well, you get to decide what you want to live, how you want to live your life.
Yeah,
If you want certainty, then you're gonna suffer.
but that is a hard thing for some people to accept,
It
isn't it?
is.
Hmm.
It is hard. Pain is part of life. Suffering's optional,
Hmm.
right? So it is recognizing, why am I trying to avoid pain when it, I don't know when it's going to happen, but I'm strong enough to manage it. And that is what ERP teaches.
Hmm. Yeah, and because OCD is the doubting disorder, you will always doubt if you are strong enough to
Yes.
be able to do anything that OCD wants you to do.
Well, I think this is a very powerful treatment. And I am, for myself, it doesn't mean that it's not challenging, it's not hard. I even messaged my members tonight and told them that I was going to do this, and
Hmm.
that I was scared, and that I was going to do it anyway,
Hmm.
because the OCD was like, "You're going to make a fool out of yourself," and
Hmm.
it's just like, "Well, maybe I will." And but I was going to be here anyway, and I was going to tell them, "Well, I did it, so I'm not going to ask you ever to do anything that I wouldn't do myself."
Yeah. It's interesting. Beth's on here a lot, says, what if I don't want to cope with the bad thing if it comes true? Beth, I didn't want to cope with the death of my wife, but I had to because she died of cancer. And when I got married, that wasn't something I was thinking. I was 8 years older than her. I figured I was going first.
First,
So you know what? I didn't want to cope with that, but I did. So whether we want to or not doesn't matter, because life doesn't say, "Oh, you don't want cancer? Okay, well, we won't give it to you then." Okay, I mean, no, life just there's some random stuff, right?
it is. It is.
Hmm.
We don't know when we're going to get sick. I get a lot of people work with people with health OCD, and we don't know if we're going to get sick. Um, but you're missing today.
Yeah, right.
And were you careful enough? Does it really matter? Does it really matter?
Can you ever be careful enough? I
Well,
don't.
that's the whole thing. I mean, I don't know if you can be, but I don't wanna spend my time being overly careful. I will do what the doctors recommend, but as for far and waiting and trying to catch something before it happens, "Oh, I caught this." No, I'm not the one. But I have to say, though, I was used to be a person that used to avoid going to the doctors.
Mhm,
And I think that that was also partly like I didn't want to know if I was sick. So I used to really avoid going to the doctors unless I was sick. And then I realized, oh yeah, that's part of the OCD thing.
mhm,
I don't want to hear any bad news because I can't cope with it. And that's just not true.
mhm.
Bad
But
news is part of life.
yeah, OCD likes to tell us we can't cope with things.
Yes. Yes, well, OCD would make me this small if it could.
I I I've often thought if I did an OCD movie, it would be two people. Like if Barbara, we were filming you, I would just walk behind you and say out loud all the things that were probably going through your brain. Like,
Mhm.
Barbara's about to cross the street now. Oh, what if there's a car coming that's going to kill you, Barbara? Maybe you should check both ways. Have you checked enough though? What if you missed something? Maybe, oh, and there's a child next to you. Did you move your arm because you wanted to steal that child away from its parents to molest it and take it home and then
Mm,
keep it in your basement? I
mm.
would just, that would be the
The
rolling,
ongoing thing, yes.
ongoing thing,
Yeah,
right?
yeah,
Hmm.
yeah. I've talked to the support group, and one of the prompts that we have done is okay. It's called OCD the musical. Write something about it, like write a song, make the backdrop for the do a prop, do something, and people came up with some really interesting ideas for OCD the musical.
Yeah.
uh
OCD the
different
musical. The
different
shittiest musical in the world. OCD the musical.
different vignettes that they would have with the different themes. And
Mhm.
yeah, but if you follow, yeah, it's if you're with someone who is spending their whole day cleaning or trying to prevent contamination, they're miserable. They have a
Mhm.
very clean house, but they're miserable.
Yeah. Uh, Rob says, I'm here supporting my wife. He doesn't have OCD. How is saying no evidence that a person with OCD, like the newspaper, not reassurance? What if someone with OCD woke up tomorrow and acted on a thought? Would they then not have OCD? I'm confused. Yeah, I'm not saying that for reassurance for everyone. I'm just saying so far, I've seen
Mhm.
absolutely no evidence of OCD being true, even though OCD says to people all day long, I'm right and do what I say in order for everything to be okay. Uh, that would mean that 100% of people with OCD have done compulsions absolutely 100% consistently. And the only reason why then people with OCD haven't gone and done X, Y, or Z is because of their 100% adherence to every compulsion that OCD tells them to do. Right.
Right. And also that most people that I've worked with and that I've heard of, they're terrified of their thoughts.
Right. Mhm.
They're terrified on acting on them. They're even ashamed to talk about them
Mhm.
because they're afraid that we're gonna call the police or we're gonna report them or something. It's just like, yes, very clear. I hear this all day long. It's not the first time I've heard this.
Yeah.
It's very
And
common.
think about in court, if you were going to throw yourself at court, say, Your Honor, I must go to jail. Why? What if I did this thing? Okay.
Yes,
Is
yes.
is that is that a jailable offense right there?
A
Or
thought, not that I've heard of.
okay.
Not that I've heard of. Although I've had people say that they would prefer
Of
if
course.
that that a
Yes.
police officer would put them in jail, or
Yes.
that
Yes.
they
Yes.
would, punish them
Correct.
for
I've heard that
that
too.
they might have had done something.
Yeah.
They're not
Just in case.
sure. Just
I've
in
had people
case.
call the police on themselves because they heard about a hit and run, even though they didn't drive that day, just to make sure.
It's just to make sure
Yeah.
I did it.
Mhm. Well, can you
Oh,
believe how
wow.
fast that hour went, Barbara? I mean,
Oh,
that just flew by, didn't it?
yes, it did.
Barbara, I want to thank you for your openness and your honesty and sharing with all of our our group tonight.
Yeah.
I know they appreciated it. Lots of thanks there in the comments. And I want to remind everybody tonight was brought to you by NOCD. NOCD, an online platform for the treatment of obsessive compulsive disorder and related conditions like body focused repetitive behaviors and tics and hoarding. We also work with co occurring conditions. And if you have questions about OCD and you're not quite sure about it and you just want some time with an expert, you can do a NoCD 411 session with us. You can go to nocd.com and set any of that up. And you can also download the NoCD app as you like. We'll be back again next week. Barbara, thank you so much for
You're
joining us.
welcome.
It
Thank you
was a
for
pleasure.
inviting me.
And thank you, everyone, for being here with us. We appreciate it. We will see you again in a week.